I have this great pleasure to introduce the topic of frugal innovation. So, what is frugal innovation? So, let me give an example from the healthcare sector to illustrate the concept and the principles of frugal innovation. Today, there are millions of babies that are born prematurely around the world, and in the Western world, we keep them in an incubator. An incubator costs $20,000 and requires electricity. And in poor countries in Africa or in India, you can imagine $20,000 is a lot of money, and they don't have reliable electricity. So to solve this problem, 4 students from Stanford University here in Silicon Valley came up with a very brilliant idea, very ingenious solution, which is called Embrace. It's actually a solution designed like a small sleeping bag. Inside, you have a material called phase change material, which looks like wax. You can just place it on a heating pad, it melts, and you reinsert that into this, and it can keep the baby at constant temperature for 6 hours straight. And this ingenious solution does not require any electricity, and it costs only $200. That's 1% of the cost of incubator that we use in the Western world. But it's not just that it's 100 times cheaper, it also delivers greater value to the user because it allows the mother to have skin-to-skin contact, which is known as a kangaroo care, with their child, which actually not only enables the physical survival of the kid, but also contributes to the emotional well-being in the long run for the child. So this actually captures the essence, if you like, of what is frugal innovation, is the ability to create simple, affordable, and yet high-quality solutions that deliver 10 to 100 times more value to patients, while at the same time using 100, if not more times, fewer resources. So that is the first dimension of frugal innovation, which is the ability to create frugal products and services for the patients in the healthcare system. But there is a second dimension of frugal innovation, which is about how do we innovate frugally. Think about today, right? In the healthcare sector, if you were to develop a new drug, it costs nearly $2 billion and it takes about 15 years. So is there a way now to innovate faster, better, cheaper in the healthcare sector? It is possible, partially thanks to new technologies that are emerging, such as the Raspberry Pi. So this actually is a computer the size of a credit card, as you can see, and it costs only $25. This has been developed at Cambridge University in England. And what is amazing is that this can become the building block, like the Lego bricks, that you can use to start building very affordable, frugal medical devices. For instance, at Cambridge in England, there is a startup called Heartfelt Technologies that is trying to deal with the problem of congestive heart failures, which, as you know, in the UK cost the public healthcare system about £2 billion a year. So what they have done is that essentially they took this Raspberry Pi and they put that into this device, which is set up at the bedside of patients. So in the morning when the patient, which have had, let's say, a heart failure a few weeks ago, they actually can be monitored at home. And so in the morning when they wake up, the system actually looks at if they have a swelling at the ankle, which is called peripheral edema. And that's basically an early sign of a looming relapse. So they can immediately contact the doctor, who can basically prescribe a different medication or schedule proactively, visit to see the doctor. And what is amazing is that, with the solution, this company, Heartfelt Technologies, did not reinvent the wheel. What they have done is they reuse existing technologies like Raspberry Pi, but also, guess what? The software used to detect the swelling in the ankle is the same software used for detecting faces, facial recognition software. They simply adapted it for another application. So this is another important message of Frugal innovation is do not reinvent the wheel. How can we reuse existing knowledge and technologies to create more value? That is, I think, the essence also of Frugal innovation, which is trying to reduce waste in every domain possible, including not wasting knowledge and technologies as well. It is clear that many of the frugal solutions that have been pioneered in emerging markets can find applications in advanced economies. There are a couple of examples that come to mind. For example, there is a solution here in the US called Text for Baby, which actually sends text messages to expectant mothers. As you know, in the United States, we have sadly, the highest infant mortality rate among developed countries. So this simple mobile solution sends text messages to pregnant mothers with the health advices on how to take care of their own health and the baby as well once it's born. And over almost 1 million women have subscribed to this mobile texting solution called Text for Baby. And interestingly, this solution was inspired by a similar solution, a mobile solution used in Mexico, where they send text messages to HIV patients to remind them to take the medications. So you can see that with the abundant mobile connectivity, we could also get inspired by these clever mobile solutions coming from the South and adopt them in the Western world. There is also the telemedicine, which I think is very well developed in India and China. In China, for example, there is a company called Newsoft that has deployed a telemedicine solution to allow doctors in cities to remotely consult elderly patients who live in rural areas, in villages in China, and suffer from chronic conditions. As you know, in China, there will be 500 million elderly citizens by 2050, and many of them are facing chronic conditions. So telemedicine is a very interesting way to do more with less in healthcare. Interestingly, telemedicine will be introduced in France, will be generalized in terms of introduction in France beginning September this year, and it is expected to save France about 2.5 billion euros a year in terms of cost. So you can see again whether the mobile kind of texting solutions or telemedicine solutions that have been pioneered first in the global South can find applications in the global North. Now, these are examples of frugal products and services, but I think we can go one step further and start thinking about how do we bring frugality in the processes, in the delivery processes of healthcare, and more importantly, how do we cultivate a frugal mindset as well in the healthcare system? And so I want to leave you with the two examples of how to do that. For example, the drug company, manufacturing company, pharmaceutical company, Novartis, they have introduced since last year a new manufacturing process, drug manufacturing process called continuous manufacturing process, which actually takes the whole manufacturing process of new drugs and compresses that into a microfactory that is no bigger than a container. And this microfactory can produce drugs 10 times faster than existing factories and reduces the cost by at least 60%, and more importantly, reduces carbon emissions by 90% and delivers better traceability. That is, it offers better quality for the regulators like FDA, for example. And of course, this is it can be put in a container and let's say shipped to, let's say that there is an Ebola kind of crisis in Africa or Asia. This microfactory can be put in a container and shipped to the destination where it can produce locally the drugs. And this, I think, is an important message with Frugal innovation is how do we go from a centralized model of producing drugs, delivering healthcare services to a more distributed, decentralized model. And I think that microfactories and telemedicine are ways to move to a more decentralized, distributed way of delivering high quality services to more people at lower cost. And to conclude, I talked about the importance of bringing frugality in the mindset. How do we essentially think frugally, not just act frugally? And here, I think it's important that in the healthcare sector, we think about the notion of co-creation. That is, how do we co-create healthcare solutions in partnership between the providers like medical device companies, pharmaceutical companies, hospitals, but also the patients and software developers or designers and engineers, so that we create a community of innovators who can co-create these frugal solutions. And here a fantastic example is the HELIX, which is an acronym for Healthcare Innovation Exchange, that has been set up in partnership between the Imperial College in London and the Royal College of Art, as well as the NHS, which is the public health system in the United Kingdom. What they have done is they have created literally a design studio, which is installed, next to St. Mary's Hospital in London. It's a beautiful studio, literally in the street, and where they invite actually patients, clinicians, doctors, engineers, designers, public policy officials to come together to co-create frugal solutions that will reduce the cost of healthcare in United Kingdom while maintaining the same level of quality and performance as well. So I think this is a very interesting way to essentially get the whole healthcare community innovate faster, better, and cheaper, become more agile and more kind of patient-centric as well, in a very human-centered, patient-centered way. So I would say, to summarize, if you think about frugal innovation, it can actually be practiced at three levels. It could be about creating frugal products and services. It could be about redesigning the entire business model to become more frugal, like Novartis is doing in the pharmaceutical sector. But it's also about cultivating a frugal mindset, which is really about becoming more patient-centric and having the agility to kind of quickly develop a new solution, test it out, and then iteratively improve it, as opposed to seeking perfection, in terms of solution and delivery mechanisms. So I tried to be very quick in the introduction. As you can see, I'm also very passionate about this topic. So thank you very much for your attention, and all the best.